Welcome back to part 10. Can you believe it? We are officially at the halfway point of our 20-part dental coding masterclass series. I'm so thrilled you're still here with me on this journey. Now, in part 9, we thoroughly explored procedural terms and clinical abbreviations, basically laying a solid foundation for the language used in the dental office. But today, in this explainer, we're transitioning from those foundational terms to understanding the exact anatomy of a CDT code itself. Look, if you're a medical coder, a dental biller, or a revenue cycle professional, mastering what we cover today is absolutely non-negotiable for your daily workflow. Let's jump right in.
Here is our roadmap for today. First, we'll look at the anatomy of CDT codes. Next, we'll define those components. Then we're going to walk through categories of service 1 through 6, followed by 7 through 12. Finally, we'll talk about navigating subcategories and wrap up with a quick summary. All right, section 1, the anatomy of CDT codes. To navigate the manual effectively, we have to zoom all the way in on the smallest unit of data. Every standard CDT code entry is built on 3 distinct architectural elements. Step 1 is the procedure code itself. This is always a 5-character alphanumeric code starting with the letter D, like D1351, for example. Step 2 is the nomenclature, which is the official title. And step 3 is the descriptor, a detailed clinical narrative. Moving right along to section 2, defining these specific components. Let's see how these building blocks actually work together. The nomenclature is the written, literal definition of a procedure code. Think of it as the code's formal, official name. For our model code D1351, the nomenclature is quite simply sealant per tooth. It's brief, it's literal, and it tells you exactly what the procedure is right off the bat. Then we have the descriptor, which expands on that brief title. It's a written narrative describing the precise intended use of the code. For D1351, the descriptor gives you the exact clinical parameters, stating mechanically and/or chemically prepared enamel surface sealed to prevent decay. So it literally tells the coder exactly what clinical steps must be documented to support the billing of that specific code. But here is a crucial rule, and you absolutely need to remember this. While every single CDT code will always have a procedure code and a nomenclature, a descriptor is not provided for every single procedure code. If you're taking a certification exam or maybe training new billing staff, you have to keep this critical exception in mind. Sometimes, the code set authors consider the nomenclature self-explanatory enough that no extra narrative is needed. With over 800 codes in the CDT manual, knowing which ones actually require reading the fine print is half the battle. Section 3, categories of service 1 through 6. Now that we've got the micro-level legend down, how a single code is built, let's zoom out to the macro map. The entire CDT code set is organized into 12 massive sections. Category 1 is diagnostic, spanning codes D0100 to D0999. That covers clinical exams, x-rays, and pathology. Category 2 is preventative, D10000 to D9099, which houses your routine cleanings or prophylaxis, along with fluoride and sealants. Now, if an issue is found, we move down to Category 3, restorative, D2000 to D2999 for things like fillings and crowns. If that decay reaches the pulp, we hit Category 4, endodontics, D3000 to D3999 for root canals. Category 5 is periodontics, D4000 to D4999, dealing with surgical and non-surgical treatments of the gums and bone. And finally, Category 6 is prosthodontics, removable, D5000 to D5899, which covers complete dentures, partials, and temporary interim flippers. Notice how these numbers perfectly sequence with the natural clinical progression of patient care? Pretty cool, right? Section 4, categories of service 7 through 12. Continuing our systematic walk through the remaining half of the code set, these categories generally encompass highly specialized treatments. Category 7 is maxillofacial prosthetics, D5900 to D5999, covering specialized facial, ocular, and various other prostheses. Category 8 is implant services, D6000 to D6199, which includes surgical implant placement and implant restorations. Category 9 is prosthodontics fixed, D6200 to D6999. This is exactly where you'll find cemented, non-removable bridges. Category 10 is oral and maxillofacial surgery, spanning D7000 to D7999, dealing with everything from simple extractions to biopsies and treating fractures. Category 11 is orthodontics, D8000 to D8999, covering comprehensive braces. And wrapping it up,
Category 12 is Adjunctive General Services, D9000 to D999. This is a bit of a miscellaneous but incredibly important category, covering services like anesthesia, professional visits, therapeutic drugs, palliative care, and occlusal adjustments. Section 5, Navigating Subcategories. Look, memorizing 12 categories is a fantastic milestone, but let's be real. To make finding the right code fast in a real-world revenue cycle environment, these giant categories have to be subdivided. All CDT code categories of service are broken down into specific subcategories. The entire purpose of this subdivision is strictly to aid navigation and streamline your code lookup. For example, instead of reading through 1,000 diagnostic codes, this functional subdivision lets you jump straight to a subcategory like diagnostic imaging to find your X-ray codes. It allows you to quickly bypass all the irrelevant stuff and zero in on the exact clinical section you need, which is an absolute game changer for speeding up your daily workflow.
Section 6, Summary, and our teaser for Part 11. Okay, you now possess the complete architectural blueprint to read any individual CDT code entry. You understand the procedure code, the nomenclature, and the descriptor. You've also got this comprehensive macro-level map of the entire 12-category landscape, right from diagnostic all the way to adjunctive general services. So here's the million-dollar question. How do we take these pristine, highly organized codes and apply them to the messy reality of a patient's medical record? Well, that is exactly what we tackle next. In Part 11, we're going to apply this coding knowledge directly to the elements of dental documentation. We'll be covering how chief complaints, clinical intraoral exams, and medical necessity all tie together to support the codes we just learned how to navigate.
To truly master coding, you have to understand the clinical story behind the numbers. So I challenge you to ask yourself, how robust is the documentation in your own clinic right now? Think about it. Be sure to like, subscribe, and drop your specific coding questions in the comments below so I can address them. Check out the full masterclass playlist, and as always, decode healthcare with Harshal.